Hi, Ray Gustafson, and we are joined on the phone by Dr. Mark Nikkel, orthopedic surgeon with Bronson Orthopedic Joint Specialists in South Haven. Good doctor, how you doing today, my friend?
Very well, very well. How are you?
Doing fine. Tell us about Dr. Mark Nikkel, and you're a board-certified orthopedic surgeon with Bronson Orthopedic and Joint Specialists. Tell me where you're located and a little background about yourself, please.
I'm located at 950 South Bailey Avenue in South Haven. I did my residency in Chicago, and that was followed by a fellowship of 1 year in sports medicine in California. I practiced in Chicago for approximately 15 years and have now since been with South Haven for the past 4 years.
Now, treating athletes with sports injuries, not the only thing that you do. You're also trained in other areas, though, right?
That is correct. In addition to sports medicine, I also perform joint replacement, typically shoulder, hip, and knee.
And so speaking of adolescent shoulder pain, then, that's the topic that we want to talk about today. What are some of the most common causes of shoulder pain in adolescents?
Shoulder pain in adolescence is typically caused, one, repetitive activity or trauma. I break that down pretty easily with those two categories.
So how do these injuries occur then in a we say adolescent or, with student athletes?
Well, typically what I come across with an adolescent, someone that has played the sport, typically basketball, baseball, football, although obviously there's other sports involved. But typically, an injury. So obviously it's seasonal, depending on the time of year. But typically, a individual will present with a particular injury mechanism. The other athlete that presents with pain is typically someone that performs sport year-round. The travel athlete, whether it be baseball or basketball, typically this patient comes and presents with pain that has been ongoing for more than a few weeks, typically a few months, and they're realizing that this pain is now starting to affect their activity and their ability to play the sport.
So what's done to treat shoulder injuries?
Typically, the first thing I recommend to the patient and their family is that they should stop the sport and that they need to get into a rest situation. This will involve physical therapy, which will restore their flexibility and balance their muscle, strengthening. Anti-inflammatory medication, typically over-the-counter, and icing are also employed. I think the most important thing that we see in adolescent athletes that did not have an injury per se, acute injury, but more due to repetitive type nature, is that they've lost their flexibility due to that sport, and they're compensating with their muscles. And restoring that flexibility and getting their muscle strength where it's balanced again will allow them to play that sport and put less risk with them in the future.
Some good information there. So if a parent feels that an injury does need attention, how can they make an appointment for their child?
They can call our office, Bronson Orthopedic and Joint Specialists, and make an appointment at 269-639-2866.
Say that number one more time.
That's 269-639-2866.
Or they could stop by your office, right?
Anytime.
And that's located at?
We're located at 950 South Bailey Avenue in South Haven.
Dr. Mark Nikkel, board-certified orthopedic surgeon, Bronson Orthopedic and Joint Specialists at 950 South Bailey Avenue in South Haven. Thanks for the tip there, my good friend, and you have a great day.
You too. Thanks for having me.